Good afternoon and welcome to the first virtual Ohio Academy of Family Physicians Wellness Week. I'm Dr. Lisa Ryder, a family physician in Dayton, Ohio, and a member of the Joy of Medicine resource team. I'm happy to be with you here today to moderate our live session. I hope you found the resources shared so far this week valuable and will take some time when you have the space and energy to do so, to dive into what's available. Our goal for the week was to bring the joy back to family medicine, and we hope we've provided resources and tools to get you there. To round out our week of live sessions and to bring all of our themes and topics together, I'm so excited to introduce our final speaker of the week, Dr. Clif Knight. Dr. Knight is currently Assistant Dean of Clinical Affairs for the Marian University College of Osteopathic Medicine. Prior to that role, he served as Senior Vice President for Education at the American Academy of Family Physicians, where he oversaw all AAFP organizational activities related to medical education, continuing medical education, CME accreditation, and journal media. Most importantly to this talk today, Dr. Knight also led the AAFP's Physician Health First initiative on improving family physician well-being and professional satisfaction. He helped create the AAFP's annual Physician Wellbeing Conference and served on the steering committee for the National Academy of Medicine Action Collaborative on Clinician Wellbeing. I've known Clif for a long time. We knew each other when I was in the leadership in Ohio Academy and he was in the leadership of Indiana. And then we also worked together when I was working on the Commissioning of Quality and Practice when we first did our position paper on physician burnout, which was in 2014. Our other guests today are Stephanie Mueller and Heather Woods, both from the American Academy of Family Physicians. After Dr. Knight's presentation, they will provide an update on the AAFP's well-being resources and opportunities. As you listen along, please feel free to share any questions in the comments section under this video wherever you are watching. Also, please include any comments or your own best practices. We'd love to see them. Use this space to connect and share with each other. With that, Dr. Knight, take it away.
Great. Thank you very much, Dr. Ryder. It's great to see you, and I really appreciate this opportunity to be with you all this afternoon. And so this afternoon, I'm going to do a bit of an overview on burnout, but more importantly, really talk then about some strategies for improving family physician well-being. And I hope you find this session very helpful. I'm talking to you today from the Michael Evans Center for Health Sciences here in Indianapolis at the Marian University College of Osteopathic Medicine. And as Dr. Ryder mentioned, I've been here as Assistant Dean for Clinical Affairs, primarily the 3rd and 4th year experience for our students now since November of last year. And so if you're ever in Indianapolis and you want to see our campus and visit, please reach out to me. I'd love to show you around. It's a beautiful place. So the learning objectives for this session are that I hope at the end of the session you have a little better understanding of sort of the technical description of burnout, but more importantly, understanding what are some of the multiple factors that go into physician burnout and well-being, and really help you to begin to develop your personal mitigation plan for trying to avoid burnout. But really, more importantly, the goal of this session is to help you embrace the goal of thriving and help you to achieve that goal. So that's what we're going to try and cover here over the next several minutes. Dr. Ryder mentioned a bit about my background. I am a family physician. I am in an administrative role. I do education and really got involved and interested in physician well-being when I was a residency program director in family medicine. And then I was chief medical officer for an 8-hospital system community health network here in Indianapolis, had 2,200 physicians on the medical staff. And I saw what that impact of burnout was, and how it could lead to physicians becoming impaired, and how that impacted the quality of care that our patients received. And so that's when I got involved in and interested in physician well-being. And then as I started working at the American Academy of Family Physicians in 2014, had the opportunity there to become involved really at the national level. And then, as mentioned, I was had the pleasure of serving as the AAFP's representative on the steering committee for the National Academy of Medicine's Action Collaborative on Clinician Well-being, and then contributed in a couple of different case studies, and helped the AAFP launch the annual Physician Health and Wellbeing Conference, and you'll get to hear a little bit more about that later in this discussion. So first of all, I want to thank you. I want to thank you for what you do every day. The things that you do are so important for the patients, the families, and the communities that you serve. And because that is important, it's important for you to be able to continue to serve others, and self-care is critical to your ability to do that. And so I say it over and over and over, self-care is not selfish. Self-care is our professional responsibility on behalf of the patients, families, and communities that we serve. So thank you for all that you do. In 2016, the AAFP recognized the importance of physician well-being, and so really made it a significant goal of the Academy to assist members in achieving well-being in order to enjoy a sustained career in family medicine. And so that is a goal that the AAFP's Board of Directors adopted in 2016. And so a lot of what I'm going to talk about sort of came out of the work that was started at that time, about 5 years ago now. So in this discussion, I'm going to give you a little bit of background and some data around burnout, and then really talk about a structure that you can utilize as you think about how you want to impact your well-being, as well as the well-being of the other clinicians around you and the other physicians, the other family physicians that you know and work with, and things we need to work on together as a community of family physicians. And then really talk about some strategies, some very specific strategies that I encourage you to consider as you develop your own personal action plan for your well-being. And then very importantly, a review of AAFP resources to help you achieve your optimal well-being. So when we first started looking at this now 5+ years ago, there were really three major themes that we heard from family physicians all around the country. One was, this is not what I signed up to do. When I went into medicine, I thought I was going to be doing something different than what it feels like I'm doing on a daily basis. Don't try and fix me, fix the system, because the system is the problem. And at the same time, though, help me while I'm working in this system that seems to be against me. So these three themes that I like to sort of summarize were this sense of betrayal, frustration, and pain. And so really, as we talk about this, the solutions are really to address those three emotions that people feel: this betrayal, frustration, and pain. And so just a little bit of background. I don't want to spend a lot of time on burnout, but I do think it's important to make sure that we're talking about the same thing when we talk about burnout. Burnout is a work-related phenomenon. It's a triad that's characterized by a loss of enthusiasm for work, emotional exhaustion, a feeling of cynicism or depersonalization, and a low sense of personal accomplishment. And it really can be any combination of these three, but the classical definition of burnout is really these three aspects together. And again, this is work related, so it's important to think of it from that standpoint. And how this plays out for physicians is that, when I first started, I loved everything I was doing, but now I don't feel that same sense of empathy or connection with my patients, because I've just sort of been beat down and I feel emotionally exhausted, and it feels like all this work I'm doing isn't really accomplishing what I thought it would. So it's that combination again. And though it is a work-related phenomenon, we certainly know that it can impact your personal life as well. And so we'll talk a little bit about that. But an interesting thing is that when you look at physicians who are burned out, doesn't necessarily mean they're not happy overall in their life, but certainly at work that decreases satisfaction at work. So that's a little bit of basics about burnout. And then the AMA has looked a lot at this, and folks at Mayo have really done a lot of work on this. And as we look at this related to medicine, what happens that is related to increased risk of burnout, and it's high workloads, it's workflow inefficiencies, and it's increased time spent at work. And then the sense of what I'm doing is not as meaningful or contributing to value as I thought it would. And really something we've heard a lot more as more and more physicians have become employed is this sense of lack of recognition or appreciation, and a sense of that I'm just a cog in the wheel, or I'm on a constant treadmill now. A loss of meaning, and then social isolation. That's one that I think is really important for us to recognize, is that sometimes when physicians are burnt out, they feel like there's something wrong with them, that they're the only ones that feel that way, and they feel isolated, and that maybe other physicians aren't experiencing the same frustrations and pain that they are, and it makes them feel kind of lonely and isolated. And then the other thing that I really like to emphasize is this, again, sense that there's been a cultural shift away from patient-centered or human values to more corporate values, focused more on finance. And that's a little bit of that sense of betrayal that I was talking about. So, the first thing I like to step back when we talk about burnout is, if you look at the piece of toast that's burned out, it's not the toast's fault. Something happened in the system there that instead of just being a nice golden piece of toast, it ended up getting burnt by the system. And that's what happens, I think, a lot of the time, is that physicians who are burnt out, it's because of the system issues that wear them down. I'm not going to spend a lot of time on this slide, but again, just to recognize that though burnout is a work-related professional phenomenon, it certainly impacts the personal life as well. And it impacts the sort of the satisfaction of the patients that are served by the other members of the care team. There are certainly financial costs to burnout. As physicians leave a position, it impacts productivity in a practice. And so there's a lot of ramifications from a professional level and from a healthcare quality level, but also then for the physician who's experiencing burnout, it can certainly impact their personal relationships. It can result in utilization of negative coping mechanisms that can lead to different substance abuses, depression, and even in extreme cases, suicide. So, there's a lot at stake here when physicians experience burnout. So just to give you an update of sort of most recent data, Medscape does an annual survey of physicians across multiple specialties, and they publish that each January. So this data is now getting close to a year old, because it was data that was collected in November of last year, reported in January of this year, but it'll give you a good sense of kind of where we are today. It's a short survey, a 10-minute survey that utilizes some of the elements of the definition of burnout, but really is more of a sense of how are you feeling about things when you're taking this survey. And so one of the interesting things to look at is that when they do this survey, and it's been done year over year and fairly consistent. When we look back now to 2015, there's actually been a bit of shift, a bit of improvement in the overall rate of burnout amongst physicians across all specialties, but still at 42%, 4 out of every 10 physicians having some symptoms of burnout is absolutely not acceptable. We need to continue to work to improve that. And some work that Mayo has done shows that the average rate of burnout across the U.S. working population is more around 28%. So we know that physicians are at higher risk of burnout than the general U.S. working population. So I just want to share a few things from that. I'm just going to move through this quickly. So by specialty, which physicians are the most burnout? Critical care and infectious diseases have moved to the top of that list during the pandemic. And I think that's kind of understandable. And pulmonary medicine is right up there. Neurology, family medicine, urology, for whatever, have always sort of been towards the top of that list. And so though family medicine isn't the worst, it's still nearly half of all family physicians in this study reported symptoms of burnout. So again, not acceptable. And when they asked those that reported symptoms of burnout whether that has a negative impact on their personal relationships, you can see 2/3 to 3/4 said yes. Interestingly, more of a negative impact for those younger physicians than for the more experienced physicians, the older physicians. So I think that's important for us to factor in as we're thinking about, well, what are some of the things that we can do to improve this? I think this is a really, really important slide here, and that is that women are disproportionately affected by burnout compared to men in medicine. So women in medicine have a higher rate of burnout than men in medicine. And unfortunately, what we've seen in the studies year after year is that just continues to worsen. The gap worsens from the standpoint that a higher percent of women have symptoms of burnout compared to men in medicine. So again, as we think about what are the strategies to improve well-being for physicians, we have to look at what the systemic aspects are that increase the risk of burnout for women in medicine compared to men in medicine. So when the question is asked, what are the things that contribute most to your burnout? And you can see that this is a question where you could give multiple answers. The top of the thing there by far was too many bureaucratic tasks. And that goes along with that sense of spending time doing the wrong things and spending then too much time at work, a lack of respect. Compensation is a factor here. It's not the most significant factor, but it is a factor. And then lack of control or lack of autonomy always is a significant part of this as well. And then you can see there are other things as well. So a point here is that different things contribute to a sense of burnout. And so there are multiple factors, and there isn't just one thing that we can fix. It's going to happen that's going to fix it for everybody. And so, this is really a complex problem, and will take a complex set of solutions. And so there's a few questions that they asked this year for the first time. And one was, did burnout, for those that reported symptoms of burnout in the questionnaire, did your burnout begin before or after the start of the pandemic? And for the majority, it actually was before the pandemic, although we can see that for about 1/5 of those that reported symptoms of burnout, it really started after the pandemic. So we certainly know the pandemic has not helped things. But the point here is burnout existed long before the pandemic. And so this is an interesting question too, is how has COVID affected your work-life happiness? And you can see that pre-pandemic, there certainly were, again, about a fifth, about 19% that were either very unhappy or somewhat unhappy. And that has increased significantly to about 35% that say that COVID has significantly worsened their work-life happiness. So then to step back, so that's the data around burnout. So as we start to look at solutions, it's important to understand a few concepts. And this is an important concept, and this is the demand control model of job stress. And that really says that the demands or the responsibilities or the expectations of your work, if those outweigh your ability to accomplish all of that, that leads to high levels of stress and frustration. And the things that offset those demands and those responsibilities and expectations are having the control to address those things, to be able to decide for yourself, how are you going to achieve those expectations or address those responsibilities that you have, those demands. So that control, but then very importantly, the support that you need. Do you have the tools? Do you have the resources so that you can successfully achieve meeting those demands and those responsibilities. So it's important for us to think about this, that when your demands of your job outweigh the control that you have and the resources that you have, you have to either decrease those demands in some way, or you have to find ways to increase your control and perhaps even more importantly, increase the resources that you have to achieve what you're trying to do. So it's a combination of control and support that can help you to more effectively meet your demands. And so, again, this question was, you could only give one answer, and that's which workplace issue concerns you the most. And you can see work-life balance for both men and women, although higher concern for men. Compensation, again, important for both. Combining parenthood and work is a significantly higher concern for women in medicine than for men, as far as being the most concerning workplace issue. And then again, a variety of other issues there. And so, over the last several years, as we've worked on this and had discussions with multiple groups of physicians and especially family physicians, a formula for distress sort of evolved for this, and it's this combination of the EMR, which kind of represents not just the EMR itself, but all of the documentation requirements, the reporting and work, the paperwork issues, all of that, and you combine that with RVU requirements, the workload, the expectations for your volume that you're going to do, and that results in this feeling of I'm sad. So EMR times RVU is I am sad. And so, we really have to, again, look at how do we address to some degree both of those issues and keeping that controlled demand formula in mind as we think of solutions. And then the other aspect to this is this sense of, when I went into medicine, I really wanted to focus on patient-centered values, but it feels like we focus a lot on financial values. And are we really focusing on what's right for our community and for our patients, or are we focusing on what's right from a corporate standpoint? Are the corporate values outweighing community values? And so this combination of feeling overworked, sort of lack of control, not enough resources, and then seeing that what we thought were the values, this can be a little overwhelming when you add that all together. And so a couple of years ago, myself and Dr. Jay Winter, a family physician in California, co-authored an article that was published in FPM, the Family Practice Management, through the AAFP, and really looked at this combination of these high volume expectations, the system inefficiencies, which lead to this sense of overwork, and then this moral injury of the things that we see around us and the lack of resources to be able to do what we want to do for high quality and develop and seeing equitable health outcomes. And it leads to this physician distress, which have multiple factors involved in that. And so, the next question is, so how do physicians cope with this? And again, physicians could put more than one answer to this in the survey. And exercise, you'll see, is number one. Being with family members and close friends. Some people just need the time away and isolate themselves. Sleep is on there. Listening to food or listening to music or playing music. But then you see some things that begin to be sort of negative coping behaviors: eating junk food, drinking, binge eating, those sorts of things. So, we recognize that people cope with their burnout in different ways. And so what I really want us now to focus on is not burnout, because it's not just that's what we want to avoid, but it's truly, how do you achieve well-being and happiness? I worry that if all we focus on is burnout, then we may decrease rates of burnout, but we may not really increase happiness and well-being, and that's what we want to do. And so I fall back to this continuum that Dr. Mark Greenewald put together and uses as the basis of the approach for the AAFP's Health and Well-being Conference for Physicians. And it's that we're not just trying to shift physicians out of burnout to survival or just being okay or fine, but truly trying to help people get to where they feel a sense of wellness and thriving. And this is a couple of definitions that I really like. A good or satisfactory condition of existence, a combination of health, happiness, and prosperity. And prosperity doesn't mean wealth, but it means being comfortable and feeling like you've got enough. So it's that health, happiness, and prosperity, a combination that I don't think anybody should feel guilty about wanting to achieve that, and I don't think we should feel apologetic about trying to do things to achieve that for family physicians. And then the second one from the CDC is describing or judging life positively and feeling good. Again, I think that's something we all strive for. So my point here with this is, let's not focus on what we don't want, which is burnout. Let's focus on what we do want, which is for family physicians to feel this real sense of well-being. And so to look at that, what is it that gives physicians a sense of reward in practice? And the number one thing that pops up, and this is across all specialties, so I bet if we did this specifically for family physicians, it would be even higher, but it's that gratitude and relationship with patients that really drive physicians in their happiness. And then, feeling good at what they do, feeling expert, and knowing that what you do does make the world a better place. Those are the top three things. And then, again, making enough money, being well compensated, fairly compensated, respected by the system is another important part of that. And so as we look at what are the solutions, let's look at things that really help maximize these aspects of being a family physician to increase the happiness. So here's something that is a bit of, I think, good news. It's really hard for me to interpret this. This is not a question that they've asked year after year by Medscape, but that they asked who's the most anxious about their future, and family docs are right in the middle of the mix. So you can see that there are physicians from multiple other specialties that have a bit more anxiety about the future, their future, and perhaps the future of their specialty. So I want to talk a little bit about a framework that we utilized at the AAFP over the last several years, and that is what we termed the family physician ecosystem. And so I'm going to very quickly go through this. You'll see this slide again in a few minutes, but it's really looking at 5 levels of things that impact the well-being of family physicians. First is the healthcare system. It's the big system where the regulations and a lot of times the documentation burden comes from. Then the next level is the organization that you're part of as a physician. So this may be a medical staff. This may be if you're employed, it may be a sort of the umbrella organization you're employed by. The next level then is at the practice level, and that's really where you spend your time. It's the team you work with. And looking at the efficiencies of your day-to-day practice and how that impacts your sense of satisfaction. And the next level then is you as an individual and what your habits and behaviors are that impact your overall well-being and health. And then the harder one to describe is the physician culture. And that's really this culture of self-sacrifice is more important than self-care. And, that is just something that's kind of been drilled into us. And so then physicians, I think, feel guilty or weak or selfish when they do things to focus on their own self-care rather than just doing things that are, sacrificial on behalf of the patients and communities they serve. And so as we look at solutions, again, I think it's important for us to really utilize this framework to come up with what are potential solutions. And so as you think about what influences your well-being, the things that can do that are the leadership of your organization, the culture of your organization. Has your organization adopted a lean philosophy around trying to do things more efficiently and respecting the individual and control of the individual, finding best practices, those sorts of things? And then within your practice team, do you have the the processes in place? Do you have clear expectations as far as roles and responsibilities? Do you know what the priorities are so there aren't conflicting priorities within the organization? For example, is your priority to provide the highest quality, safest care for your patients with a great experience for the patient, or is the priority to maximize your financial impact? And when you've got people that are working with different sets of priorities, this can lead to unhappiness and frustrations. And then again, looking at your own habits and behaviors and how that impacts your health, your sense of well-being. So the point here is, again, there are multiple things to consider as you think about how to put this all together in a plan to help. And again, this culture of accepting the effects of self-sacrifice over self-care as sort of the price of admission to our profession as physicians. So burnout's a problem. The system is the cause, but together we are the answer. When we work together, we have more of an opportunity to make an impact at the system level, the organization level, find those best practices, share those, support each other in the culture that we want to see improved, and hold each other accountable to look at our own healthy habits and being healthy role models for each other and for our patients. I'm not going to spend a lot of time on this, but resilience, I think, is an important aspect of this. And understanding what does lead to resilience. And again, this is a real easy read. It's a book that's been out for almost 10 years now. And they talked to people who had been through significant personal trauma. And they looked at why did some people weather that trauma and come back really stronger and with a more positive attitude than they did before the trauma versus those that, for whatever reason, could not overcome the impact of that trauma and never regained sort of a sense of well-being. And they found 10 factors that were related to those that have the ability to bounce back and actually grow in the midst of adversity rather than wilt. And so I'm not going to go through all these, but one that I think really jumps out to me as I read through this and as I've talked to physicians is this continued sense of meaning and purpose. And so this was really a sort of a reiteration of a Nietzsche philosophy from the late 1800s. But Viktor Frankl, a Holocaust survivor, said, "Those who have a why to live can bear with almost any how." And I think that is important for us to continually connect to our why, our purpose. And when I have done discussions with family docs, so this is 200 family physicians in a conference on a topic just like this from earlier this year, and the word cloud that popped up when I asked, what's important to you, what gives you a sense of well-being, these are the things that popped up. So I want to spend just a little bit of time talking about connection, gratitude, mindfulness, and making a good use of your time. And so just 4 quick sort of suggestions as you think about your self-care plan. And one is to continue to connect to your purpose, as I just mentioned. This is a real easy read, The Art of Happiness at Work. It's a sequel to a book called The Art of Happiness that the Dalai Lama did. And it's a physician, an MD, that actually interviewed the Dalai Lama. And so when you read through this, it's in an interview format. But his point was those of us at work, we work for a variety of reasons, but it kind of boils down into 3 things. We work because it's a job. We wouldn't do it otherwise, but we get paid to do it, and we need to be paid. We need the money, so we do our work because it's a job. The second then is career, or sort of social status, or achievement. And so we do what we do because of that aspect of being lifted up by society for the esteem that our career gives us. Again, kind of achievement driven, and then as a calling, and that is doing something that really means something to you, that is attached to your soul, to why you believe you exist, is the purpose of that. And in reality, I think for each of us, there's probably some mix of this on a day-to-day basis in the work that we do. But I am convinced that without feeling a sense of achieving your calling, being connected to your purpose, a successful career and being paid well is not enough to sustain happiness and well-being. And so, again, always trying to find a way to connect to your purpose. The why you became a physician is really important. The second aspect then is gratitude, and there's good scientific evidence behind this that that being intentionally grateful helps with your sense of well-being. And part of it's a mindset. The happiness is not having what you want, but wanting what you have. Meaning, don't focus on what you don't have that you wish you had, but really recognizing that what you have is pretty special, and being grateful for what you do have. And again, there is science behind this, and how a sense of gratefulness impacts the neurotransmitters that lead to a better sense of well-being. There's a philosophy or a theory that I really believe in, and that is when you are intentionally thinking of happy things that you're grateful for, that humans aren't really capable of feeling both happiness and sadness at the same time. And so if you develop a habit of gratefulness and gratitude, you sort of have developed a habit of not thinking about negative things. It's something to consider. And there are different ways to do daily gratitude. There are studies out there that if you spend at the end of the day, if you think about things that happened that day that you were grateful for, if you start the day with something that you're looking forward to in the day and looking for those opportunities to be grateful for the day. So my point here is there's not one way to do this, but I encourage you to think about how you work a sense of gratitude and being deliberate about this into your habits. And this is an example here at the Evans Center at the College of Osteopathic Medicine. We have one of our janitors, our environmental service staff, that he gets here about 3 a.m. He's got the building spiffed up every day when we come in, and every day he puts a different message on the signboard. And the theme that he puts on there on a regular basis is thankfulness. Thursdays are Thankful Thursdays. And nobody told him to do this, but he gets a real sense of contributing to the team's morale by doing this every day. And this falls into the category that I've really come to appreciate over the last year and a half in the pandemic, is this sense of receiving grace from others, the importance of giving grace to yourself, and offering grace to others. And grace is that love I don't deserve. I didn't do anything to deserve your compliments or your gratitude necessarily, but when I feel that, and then that sense of forgiving yourself when things aren't going perfect, is such an important part. So gratitude is all sort of wrapped up in that. Real quickly then, a couple more things. Mindfulness and meditation. I personally don't meditate, but I try and be mindful. I try and keep in the moment. And what I find this helps me do is tame that negative voice in my head that always reminds me that that I'm not perfect, and trying to remember that that's okay not to be perfect because I'm human. But if I don't mindfully approach this, those negative voices have a chance to sort of take over at times. And so by trying to stay in the moment, enjoying the now rather than worrying about tomorrow, and being more self-aware about things, that has helped me. And this is a resource that, again, is pretty easy read. I like the concept. The author here, Dan Harris, talks about the fact that you're never going to be perfectly happy, but maybe there are some things you can do to be 10% happier a week from now, a month from now, a year from now than you are today. And what are those things that you can do? And it really focuses, he focuses a bit more on meditation, but there's also a lot in there about mindfulness. So just a resource to think about. And they've got a whole series of books and podcasts and websites, but it's this concept of 10% happier. And I'd encourage you to think about looking at some of those resources as an example. The last tip then, my fourth one here, is prioritizing time. Time is the most precious thing that you have. You can't control time, but you can self-manage and look at how you're using your time. And so this comes from the 7 Habits of Highly Effective People. Again, an easy read. It's something that over the last 30 years, I've probably pulled this book out more than any other book. Personally, my favorite one is seek first to understand and then to be understood. That has helped me more with anything in my life, is to try and understand others before I try and make people understand me. But one of the other ones here is prioritization, and it's put first things first. So how do you do that? How do you prioritize and put first things first? And a tool that comes out of this book is the time management matrix. And this is looking at all of those things that you need to be doing or that you could be doing and prioritizing, and looking at, is this thing that you've got to do or think you've got to do, is it important or is it not important? And is it urgent or is it not urgent? Is it due soon or is it not due soon? And then you put these into these 4 quadrants. So the urgent quadrant for important things is quadrant 1. And then there's quadrant 2, which is not urgent but important. Quadrant 3, which is not important but urgent. And then the not urgent, not important things in quadrant 4. Most of us spend our lives in quadrant 1 and 3, dealing with those things that are really urgent and important, but also dealing with a lot of things that are urgent, but in the big grand scheme of things aren't important. And the hard part then is to move from quadrant 3 to those things that aren't important to quadrant 2, where you're focusing on things that are very important, but they just aren't urgent. And that takes a lot of self-discipline, and it takes planning to do that. And so these are important things like relationship development. It's taking the time to exercise for your self-care. It's finding those other things that help you develop yourself professionally. And so, these are things that a lot of times aren't urgent, and so they aren't on our priority list because we've got all these other things that are urgent, though they may not be nearly as important. So this is just a way for you to sort of organize as you're prioritizing the use of your time, and hopefully learning how to say no to those things in quadrant 3 and 4, and focusing more time on things in quadrant 2. Because actually, if you spend more time in quadrant 2, eventually you'll spend less time in quadrant 1 because those crises don't occur as much. So again, this is related to being intentional and trying to be in control of your time, and looking each day at what you can do to help develop your mind, your body, your heart, your soul, and being, again, intentional about this. So my best wishes to you in your personal journey to achieving your health, your well-being, and professional happiness. You deserve it, and you need a plan. It's not just going to happen. And I also need you to include in that plan what you're going to do to help your fellow family physicians, either in your practice, in your organization, or by helping focus on those system issues and changing the culture. And so I want you to have a plan for how you help with your own well-being, but also if we don't all work on this together, we aren't going to achieve as much. So consider connecting your work to meaning and purpose, intentional gratitude on a daily basis, some sort of mindfulness or meditation, whatever works for you, and then prioritizing your time, not just at work, but also your personal time as well, and striving to thrive. So remember, self-sacrifice is noble in service to others. However, self-care allows you to sustain your service to others for the long run. And these are a couple of my sources of joy. This is really the reason I moved from Kansas City and working at the AAFP, where I loved what I was doing, to Indianapolis, and now at Marian University, where I love what I am doing every day. But I also love the fact that I get to spend more time with my grandkids that are here in Indianapolis. So thank you for letting me to indulge with that. So a few things from the AAFP before I turn it over to my colleagues from the AAFP. The AAFP has measured these aspects since we kicked things off in 2016. And have been watching and asking the same question each year. Would you choose to be a family physician again? And we believe that if we are addressing those system factors and making a difference, that we'll see more family physicians choosing to continue to be family physicians. And so this is encouraging that we've seen a 5% increase in the first few years of our efforts. That 5% more family physicians say they would choose to be a family physician again than were when we first measured this. And there's more recognition that the AAFP is offering effective resources to help family physicians with their own well-being. Again, only a quarter of our members said that they felt that the Academy was doing that when this really kicked off in 2017. And now it's 2/3. So making progress. Need to get that to 100%, but better. I'm going to skip that slide because it's kind of busy and I want to turn things over to my colleagues from the AAFP. Please feel free to reach out to me with any questions or follow-up that you have. And I will turn it over to Stephanie and to Heather. Thanks.
Okay, hi. Thank you for allowing me and Heather to come present. My name is Stephanie Mueller, and I'm a program strategist at the Academy working in our online team and our CPT division, which is currently the Clif, where Clif worked as well. As he kind of discussed before, we have our Physician Health First initiative that started back when he was on board about 2014, 2015, I believe. And Cliff, you can correct me later if I'm wrong. But our slogan and our logo is "My people, my practice, my physician," and always putting you above all else. So our Physician Health First, the motto is "It starts with you." And the AAFP believe is nothing more important than your overall well-being. And so this, again, when the program started, it's devoted to improving well-being overall and your professional satisfaction by addressing the 5 points of entry that you saw in Clif's earlier slide of the ecosystem. And over here, and the American Academy of Family Physicians Foundation is what founded it. So they help make this possible for us. And you can see on the right-hand slide that the Physician Health First initiative is so big in itself that we have several components or other arms that make it up. We have the well-being portal, the physician well-being index, which is where you measure overall well-being. We have the physician well-being conference that Dr. Clif Knight also mentioned earlier. And then I believe Heather might be discussing that a little bit later as well. And then we have the leading physician well-being certificate program, which she will spend the majority of her time talking about as well, which is a new initiative that just started this year. I'm not going to take a lot of time on this slide because Dr. Knight already discussed it, but essentially this is just a reminder that a lot of our content and materials are built around this ecosystem and these points of entry that impact the areas of well-being. So this right here, the AAFP.org/mywellbeing is where you get to our well-being portal, which is essentially our centralized hub or landing page to find all documentation. And you can find any resources related to well-being on this landing page. So kind of focusing on what is new and what's to come in the areas of our content. So I hope everybody can see this. I apologize if it's really small. But we do have a COVID CME webinar series. And even though it's not all applicable to well-being itself, this was a pandemic that you can say kind of covered well-being in itself because there was so many factors to it and it's ever evolving. And specific to that, we did have specific sessions in there that related to well-being overall, if you did want to check those out. We also knew this year that launched in July, we had the Overcoming Imposter Syndrome, which we know can affect any physician. And here you can get the perspective of 3 different physicians that are or have experienced it and all with all different backgrounds. And it is free. It's CME. So please check that out. We also have the Physician Mental Health Preventing Suicide and Building Resilience that was part of our Leading Physician Wellbeing program that Heather also will discuss, like I mentioned earlier. This is another free session where the American Foundation of Suicide Prevention's Chief Medical Officer talked with Dr. Frank Clark, who's also the Medical Director of Adult Inpatient Services at Marshall Pickens Hospital. And they were just discussing mental health and check-in resilience. And they were also presenting data on mental health and suicide prevention, as well as Dr. Cloth telling his personal story of the struggles with that and how he overcame. Now, content materials that are new is we do have on that landing page that I showed you on our physician wellbeing portal, we do have the COVID-19 wellbeing page, and you can find anything applicable to COVID-19 on the page, from additional resources to materials to opportunities to phone numbers if you need help or know of somebody who needs help. That link is on the portal as well. And then we do have new materials that are coming up within the next couple of months that will be focusing on suicide prevention as well as depression. I think there will be around 9 different articles or materials related to that. And then also you can check out our FPM journals, who have a lot of topics specific to well-being. And with that, I'm going to hand it over to Heather. Thank you.
Okay, thank you, Stephanie. So I'm going to go over the physician health first. The conference, the health and wellbeing conference that we put together every spring. This past year we were virtual, so we did this conference over a virtual setting platform and had a great group of people, and we were really able to still have the same kind of connection with folks in a virtual setting, which is really nice. We are happy to announce that we will be live on the ground again in Naples, Florida, over March 30th through April 2nd. Registration will open this fall, so stay tuned for some more information of when those registrations open and then when you can start booking hotel rooms. But we're really excited to be in person again and have everyone join us there. I'll go into our Leading Physician Wellbeing Certificate program that Stephanie touched on a little bit. So the background of this was that it's a United Health Foundation grant. So this was written to support only this programming. It's a $3 million grant for 3 years of funding, and that will give us 2 cohorts. We are currently in our first cohort this year. So I'll give a really brief overview of our cohort 1. Here's some of our lovely cohort members. As you can see, we have a very diverse group, and some of our chairs are listed here as well. Lots of happy faces. So some of the biggest pieces of this cohort and of the grant deliverable was that we would have majority of our physicians as scholars would be less than 7 years. And as you can see here, we definitely met that with our 84%. We do have a few residents who are part of the program, and then a few of our physicians who are the 8 to 14 years. This is important because we want to ensure that we're creating future leaders and seeing groups of folks get involved in this program that maybe have been traditionally underrepresented in leadership roles within organizations. So very crucial. We have 120 scholars that we offered the program to this year because we were live streamed for everything. So we were able to have a few more folks come in, and we currently stand at 110 scholars. We lost a few early on because of the commitment, and we definitely think that the pandemic also had something to do with this as well. Female representation was also crucial to this program. So as you can see, we have about 89% females who are involved in this program. And then we have some majority of MDs, and then, a good amount of DOs as well. Another interesting piece is you can kind of see the workplace type is all over the map for this group, and it's really allowed our scholars to have fantastic conversations and think about different things. We've had a lot of scholars who have changed their organizations and where they work this year as well. So hearing different perspectives of people who are in different types of employed statuses, or maybe they're with different residency programs, has been really crucial, I think, to these folks wanting to continue obviously practicing, but looking at different opportunities that might be available to them. And then by state, we like this graphic just because it kind of shows our reach of, we have a pretty good track record of, catching most of the states. We even have Alaska and Hawaii. We have one person from Ohio. So, and then one person from Canada as well. So we really like that map. These are our core faculty members, and they are a wonderful, wonderful, wonderful group to work with. We are doing our pieces on 3 platforms, so leadership development, performance improvement, and well-being advocacy. And then you can see how all of these kind of interact with each other to put together our program. So all of our topics, they generally tend to kind of meld in with each other. A lot of our sessions have kind of covered all those different pieces. Then we have our themes at a glance. So with our program, we have 4 webinars, 3 multi-day activities, one of which is a bookend of the conference. And then we've had 2 guest webinars as well. So first we were setting the stage, working through how to kind of improve these systems, beginning our project, best practices, adding to our toolbox is a huge piece that the scholars just enjoy so much. We've been working on some skill stations that are built around well-being and leadership and those sorts of topics. And then at the end, we will have a showcase where our scholars will be able to present their systems well-being improvement project, which will also allow them to get PICME and also ABFM credits as well. Guest programming, like Stephanie had mentioned, we have the American Foundation for Suicide Prevention, did a fantastic and very emotional webinar for us. And then we've also done a lot of work with the Balance Society. We had them come to our first multi-day activity where they kind of give an intro. And then we had 3 offerings of webinars so they could practice Balance work. And then our scholars we had about 70 scholars sign on to continue that Balance work. So they meet monthly for 6 months to just continue that work and continue to grow in that space. Then we have our Systems Wellbeing Improvement Project. This has been really exciting because it's so different than what a lot of our physicians have done in terms of an improvement project. So we have a rather robust timeline of deliverables, but this is basically the 10-month program and how all of those things kind of ended up to be. So you can see where the PI, CME stages and assignments, those open up, which has worked out really nicely to kind of give them a nice cadence to get some information from the program and then be able to kind of turn those pieces into charters and then go through the assignments. And like I said, it will end in a showcase with their peers to hear about, their project and all of that. Majority of our scholars will be done with this project by the end of next October. So they do have time to kind of work on it as best it works in their own schedule. This is important to us mostly because of the pandemic, and we know that life happens sometimes. So this is kind of a crucial piece to be able to allow them to do the 10-month program and then have an extra year to kind of finish this project. Because at the end of the day, we would like to have all 110 scholars complete those projects for us, because it helps our community and our systems and their organizations. Cohort number 2 is right around the corner. So mid-September is when we will release the application for this program. It's a rather robust application where we do ask, for some short answer questions. We are looking for certain demographics like, your reach within your organization, 7 years and under, and, female physicians are definitely some of the higher points that we're hoping to have with that. And so that program, the application will close in, here we go. So mid-September is when we'll have the application open. And you'll see probably lots of notifications about this, including in some information from chapters as well. Then the application's due November 5th. And then we'll review those applications for about a month. We have a multi-level application review. And then our cohort would be selected in December. And then in the month of January, we would have our cohort then make their acceptance for the program and do some pre-work. This is just a quick overview of the schedule that we'll have for the next cohort year. Like I said, in January will be acceptance and some pre-work. We did some DISC assessments. We did Strengths Finder. And then we have a robust evaluation component with this program too. So we had a baseline survey that we asked all of our scholars to complete. And then our internal evaluation team kind of tracks them throughout for the rest of the program year. Like I said, we'll have our 4 webinars. We'll have some activities with the Physician Health and Wellbeing Conference in Naples, and then we'll continue to have some guest activities as well. This will be a hybrid year, so we'll have 2 activities on the ground, and then 1 multi-day activity in the middle there in May will still be live streamed. So hopefully we can meet everyone's needs with that and try to be hybrid. The original goal was to be 100% on the ground originally, but we all know that things have changed since COVID. So, yeah, that's all that we have for this. And then for contact information, it's right here. And I believe we'll be sharing these slides as well. Stephanie's and my own emails are here. And then we also have our general LPW email that Stephanie and I both manage. So thank you.
So I've been told we do not have any live questions, but I did try to think of a question for each of you. So my first question will be for Dr. Knight. And I was just, I thought about you saying that burnout is a complex problem with complex solutions, and you gave us a lot of suggestions. But if a member were going to do one thing, what one thing would you suggest that they do?
Yeah, that's a great question. And, I think it's a matter of what your priorities are. And so if you're going to do one thing, I think you need to reflect and really try and get a sense of what do you have some control over? Because, you can worry or complain about all the things you have no control over, and you're just going to set yourself up for frustration if you focus on those things. So I think you have to focus on what you have some control over or some potential influence on, and to decide that's something you're going to put your energy into. So I'll use an example. If you're part of an organization and you feel like the organization doesn't understand the importance of physician well-being, and they have certain requirements or things in place that you feel like are counterproductive to physician well-being, think about how it could be better and approach your leadership and say, this is a concern I have, and here are some suggestions on what I think we can do together to make that better. Because I can tell you, if you just go and complain and say, fix it, people aren't going to listen. But if you go to them and you show that you have thought of in a careful way, in a thoughtful way, about what those barriers are in your organization or in your practice, and you've thought about some things to try to make that better, and you approach that leadership with that spirit of let's work on this together and make it better for everybody, you are more likely to get to be listened to and to have the opportunity to get involved and make things better. And so that is something that I think you should consider, is where do you want to put your energy to try and help things in your organization or at your practice level. And then on an individual basis, again, finding a way to remove some of the unimportant things that are, that consume your time, whether that's work or personally, and focus on the things that are more important to you. And, I think there's a triad of exercise, nutrition, and sleep that physicians know about this intellectually, but we haven't been good at being given permission to try and maximize appropriate sleep, good nutrition, and healthy exercise. And so trying to find a way to prioritize your time to be able to include those things on a regular basis may be the first thing that you could do from that standpoint. So I encourage you to find 2 things: one that makes the environment better for yourself and others, but also then something you can do personally that's going to impact your well-being.
Thank you, Dr. Knight. That got 3 loves on Facebook. So even though people aren't asking questions, they're out there. So my next question is for you, Stephanie. And if a member does not have the link to get to the resources for the Physician Health First website or part page, what search terms would they need to use to be able to find it from the homepage?
Go.
Hang on 1 second. Okay, sorry about that. Oh, sorry. Okay, are we good now? Can you hear me okay? Okay, I'm so sorry about that. Yeah, so if you just go to our main AAFP.org webpage, if you even type in well-being, it should populate in one of the searches.
How about if you typed in burnout? Would it go there?
Yeah, I think we did put in a few few key words, and I gotta see physician burnout. It might be on that list. I might have to get back to you on, because we have several keywords you can type in to pull it up.
Okay, I was just curious because, well, I was just curious. Okay, then my last question is for Heather, and that was more about once you've gone through the program, what are the next steps? What is the Academy envisioning for a person who has a certificate? Oh, let me say it right. A certificate for leading physician well-being.
Yeah, great question. And this is something that we are, trying to work through ourselves right now also, because, we want to hear from the scholars of what they envision for their future as well. So one big piece that we've been talking about is that they can bring this home to their own organization, of course, and share what they've learned from the program and either through brown bag lunches or presentations, hopefully also signing up to do CME sessions with us as faculty, with our other activities that we have. And if they're interested, get involved with our cohort 2 and helping us as mentors, or if they really enjoy doing we call it a SWIP, their SWIP project, coming in and holding office hours, kind of like a peer support type thing. So that's what we've really talked about it a lot, and really going out into the system and being that champion for the program, and then also for leading around well-being is really the big piece of that reach. So it's really about bringing it back to their community and then getting involved in future program years and activities.
I have a follow-up question. It's really a comment, not a question, I admit. So from my perspective, because I've been interested in burnout and physician well-being for quite a few years, and I have read about systems that like where they'd have even a physician as a well-being officer in the organization, and so I just didn't know if that's the sort of thing that you would be prepared or becoming prepared to do that sort of thing in the future, as hopefully that spreads, because it's certainly still a problem.
Yeah, and I'd say definitely, we do have some scholars who are in a role that is similar to that, with really no background or helpful information for them to be able to do that role well, maybe, or support. So this program is really given that to them for that. And then our hope is that people can take that and maybe start creating more of those roles in different organizations, as we know it's just completely crucial to to the health and well-being of our physicians. So at the end of the day, I do see that, and we have people who are currently using this program to get that skill set, even though they're already maybe having that position or that hat on.
Well, that's really great to hear, because I think that would be a really wonderful direction or wonderful thing to happen as an outcome of the program. I do have another question. This is actually like a follow-up question. Are you able to share who the Ohio scholar is, the scholar who's from Ohio? Are you allowed to say that?
No, I should have probably looked that up before this presentation, but I would be more than happy to share that with the Ohio chapter and let you guys know.
Okay, we
That would
like
be
to
the
know
great-
and celebrate our own, so
Yeah,
that
definitely.
would be good. All right, I'm going to check and see if there are any other questions, because I see this like 3 comments thing on here. Oh, let's see here. Our current president of the Ohio Academy of Family Physicians, Dr. Sevilla, says, great presentation. Always great to see Dr. Knight. Let's see here. That might be it. Okay, very good. All right. And Stephanie says the best way to find the Physician Health First portal is to type in well-being. But if they do type burnout, it will give them several resources that will eventually get to the portal. So good. That's great to hear. All right. Anybody with any last comments? I do have my comments to make before I go to them. Okay, then I'm going to go to my last bits. Okay, so, well, thank you all for your presentations and the information, the resources, and that you've given us as Academy members to access, and we greatly appreciate that. Thank you again, Dr. Knight, for sharing your time and expertise with us this afternoon. I know we all feel not just a bit, but a lot more prepared to navigate our own journeys of physician well-being. And thank you to our live viewers for listening in. For anyone who wasn't able to join in live, this session is being recorded and will be shared on the Wellness Week webpage, as well as the Ohio Academy of Family Physicians Facebook and YouTube pages. Finally, a few quick reminders for the remainder of the week. Take part in the Wellness Week Challenge to focus on physical activity and gratitude each day. If you submit your Wellness Week tracker by August 20th, you have the chance of winning, so it's an incentive program, an OAFP logo item. There's more information in your daily emails about that. If you're ready to connect with some other family physicians, please join us in our virtual family medicine party tomorrow night. It's hosted by the Ohio Academy of Family Physicians Foundation. It's at 7 p.m. and there's still time to register for that. It's free, but you do have to register to get the link. We'll be recognizing the Philanthropist of the Year and the Mentor of the Year. And we're also going to have trivia. And also there's a cocktail mocktail opportunity for you to get some creativity in the beverage place. Our annual members meeting is this Sunday, August 15th. You'll also have to register for that, but it is free to attend. And it doesn't say, but I'm almost positive it starts at 6 p.m. And then tomorrow's theme for our last day, I'm sorry for my standard poodle barking. Our tomorrow's theme is embrace and prioritize your creativity, have fun. So be sure to check out the Wellness Week webpage for submissions from OAFP members on their hobbies and passions and work outside of medicine. Hope you enjoy the rest of your Thursday. Stay well, be well. You are not alone.